Breastfeeding and COVID-19. Current evidence suggests that breast milk is not likely to spread the virus to babies. You, along with your family and healthcare providers, should decide whether and how to start or continue breastfeeding. Breast milk provides protection against many illnesses and is the best source of nutrition for most babies. If you are breastfeeding, you can still receive the COVID-19 vaccine. Here are some helpful tips for restarting or starting breastfeeding. You may find it harder to start or continue breastfeeding if you are not sharing a room with your newborn in the hospital. Here are some helpful tips. Frequent hand expression or pumping will help you establish and build a milk supply if you are separated from your newborn in the hospital. Pump or feed every 2 to 3 hours or 8 to 10 times a day, including evenings, especially for the first few days. This will help the breast to produce milk and prevents blocked milk ducts and breast infections. If you are unable to start producing milk in the hospital after birth, or if you have to temporarily stop breastfeeding during your COVID-19 illness because you do not feel well, you can get help from a lactation support provider. You can also learn more about restarting breastfeeding, which is also called relactation. You should always wash your hands with soap and water for 20 seconds before breastfeeding or expressing breast milk, even if you don't have COVID-19. If soap and water are not available, you can use a hand sanitizer with at least 60% alcohol. If you have COVID-19 and choose to breastfeed, wash your hands before breastfeeding. Wear a mask while breastfeeding and whenever you are within 6 feet of your baby. If you have COVID-19 and choose to express breast milk, use your own breast pump, not shared with anyone else if possible. Wear a mask during expression. Wash your hands with soap and water for at least 20 seconds before touching any pump or bottle parts and before expressing breast milk. Follow recommendations for proper pump cleaning after each use. Clean all parts of the pump that come in contact with breast milk. Have a healthy caregiver who does not have COVID-19 that lives in the same household as you to feed the expressed breast milk to your baby. That caregiver should also be wearing a mask anytime they're taking care of your baby. Keeping your baby safe and healthy. Do not put a face shield or a mask on your baby. Children younger than 2 should not be wearing masks. A face shield could increase the risk of sudden infant death syndrome or SIDS, which includes accidental suffocation or strangulation. Babies move around and their movement can cause the plastic face shield to block their nose and mouth and could cause the strap to strangle them. The CDC does not recommend using face shields as a substitute for masks. Limit visitors to see your new baby. The birth of a new baby is a significant life event, which typically brings family together to celebrate and support the baby and the new mother. However, before allowing or inviting visitors into your home or near your baby, consider the risk of COVID-19 to yourself, your baby, and those that live with you, and visitors, including grandparents or older adults who may be at an increased risk of severe illness from COVID-19. Bringing people who do not live with you into your home can increase spreading the virus of COVID-19. Some people who don't exhibit symptoms can still spread the virus. Limit in-person gatherings and consider other options. For example, celebrating virtually for those who want to see your baby. If you do plan to have people come visit in person, ask guests who are feeling sick to stay home and ask them to stay 6 feet away and wear a mask and wash their hands before they come visit your home. Know the possible signs and symptoms of COVID among babies. Most babies who test positive for COVID-19 have mild or no symptoms. Severe illness in babies has been reported but appears to be rare. Babies with underlying medical conditions or who are born premature earlier than 37 weeks might have a higher risk of severe illness from COVID. Reported signs among newborns with COVID-19 includes fever, being lethargic, runny nose, cough, vomiting, diarrhea, poor feeding, and increased work of breathing or shallow breathing. If your baby develops symptoms or you think your baby may have been exposed to COVID, you should get in touch with your baby's healthcare provider within 24 hours and follow the steps for taking care of children with COVID. If your baby does have COVID-19 and is exhibiting warning signs such as trouble breathing, call 911 or call ahead to your local emergency hospital. Notify the operator that your baby may have COVID-19. Bringing your newborn for visits. Ideally, newborn visits are done in person so that your baby's healthcare provider can do the following. Check how your baby is doing overall. Check your baby's growth and feeding. Check your baby for jaundice, which is a yellowing color of the skin or eyes. Make sure your baby's newborn screening tests have been completed, which includes a blood draw, a hearing test, and testing for critical congenital heart defects, and do any follow-up or repeat testing if necessary. Call and notify your baby's healthcare provider before visiting if you think you or your baby may have COVID-19. Ensuring safe sleep for your baby. During the COVID-19 pandemic, parents may feel extra stressed and tired. Making sure babies and parents are getting enough quality sleep is very important. Taking the steps to reduce the risk of sudden infant death syndrome or SIDS and other sleep-related deaths by doing the following. Place your baby on their back for sleep at all times, naps or evening sleep. Use a firm, flat sleep mattress, such as a crib covered by a fitted sheet. Have the baby share your room, but not your bed. Your baby should not sleep on an adult bed using a soft mattress, couch, chair, and the baby should sleep alone, not with you or anyone else. Do not cover your baby's head or allow your baby to become too hot. Signs that your baby may be getting hot include sweating or feeling hot to the touch. Do not smoke or allow anyone to smoke near your baby. Ensure your own social, emotional, and mental health. Call your healthcare provider if you are experiencing depression after pregnancy.